Hey, good afternoon, everybody. Thank you for coming out today. For those of you who have been with us in the past, this might look a little bit different to you. Um, I'll get to that in a minute. I'll tell you exactly why we're doing it a little bit differently today. But back up a second for the people who have not been with us before. My name is Eric Malice, and I am the Chief Product Officer here at National Test Systems. I am also the co-founder. I've been doing this for about actually a little over 20 years now. And ever since the beginning, ever since my brother and I started this company, he's always the one that was good and focused on, sales and marketing and all that other fun stuff, where my focus has always been the tests themselves. I wanted to know everything about drug testing. I wanted to know how they worked. I wanted to know how drugs worked on the human body. I wanted to understand all of this, really just everything clinical toxicology, but especially as it relates to what we do, which is drug testing, obviously. So that's always been my focus. And now education is our big focus, and I'm so glad that that this company is so focused on education. I can see a good amount of you here today that obviously echo the sentiment to some extent. We feel that understanding drug testing, understand how these things work, is definitely bound to make your daily drug testing duties a little bit easier, or at least a little bit more insightful. So we've got about a 15-minute presentation today, after which we're going to go ahead and get to any questions you may have. As you can see in the left pane, I guess this is backwards on here, on the left pane of your screen, you should see there's a section for questions. Please enter your questions in that question section, and when I finish the presentation, we'll begin to get to all of them. If for some reason we don't get to everybody's question today, just know that your consultant will reach out in the next couple of days and they'll answer your questions. Unless your consultant is Kelly, he's off getting married, so make sure you congratulate him when he gets back. But anyway, I digress. So when the consultant calls you, they're also going to give you an opportunity to make suggestions for topics for future webinars. They're going to give you an opportunity to request a one-on-one training with myself and your staff, either on this subject or any other subject that you feel might be helpful or useful to you guys. So like I said, we got about a 15-minute presentation today. And today we're going to talk about, today's actually another in our boot camp series. We're going to be doing the basics of saliva drug testing, or oral fluids testing as it's known. So that's the reason we're doing it a little bit different today. Usually I get to hide behind my nice slideshow and my bullet points, and I get to stay in the little corner and kind of be unobtrusive. Unfortunately now you've got me and just me, so apologize. Also, one quick warning here. I've been pretty careful about this. We did practice it a couple of times to make sure. It's possible you may see some saliva. Now, I know everyone has a different threshold of discomfort when it comes to bodily fluids. My wife Tammy is a dog groomer, and she can express anal glands all day. But if, the minute a young child comes near her with a runny nose, she's heading for the hills. So I'll be careful, and I'll do my best to not let you get a good look inside my mouth, but just know it could happen. So first of all, we're going to work on our Drugstore brand oral fluids test. Now, the reason the oral fluids testing has become so popular, especially during pandemic, is because all this can be done. This can be done start to finish without anything leaving the view of the camera. This is not necessarily the best camera angle. If you were doing it with a drug court participant, for example, you could have them back off the camera a little, maybe show their desktop or their tabletop. And this whole thing can be done without being out of your view. So there's no chance of adulteration. Oral fluids tests are almost unadulterable. That's probably not even a word. But it's good to be able to watch the whole process from start to finish and just know that there's no nonsense going on. Another thing about this is we're just going to focus on this particular test for today, but whether you have that test or whether you've got this guy or whether you've got this guy, they all have the same functionality. So while it may look a tiny bit different than what you're doing now, just know it's the same functionality. They work exactly the same. All right, so let's get going. So first we've got the white foil pouch. Obviously it's not plain white anymore, but the name's stuck, so we keep it up. The more important information is on the reverse of this white foil pouch. Here we have the catalog number, a brief description of the product, including the drugs that it's testing for. Then we've got the lot number, and then most importantly, the expiration date. Now you got to be aware of the expiration date. You never want to use a test that is expired. This information can also be found on the box, on the outside box, so it's always good to at least check the box if you don't check the foil. When you get these tests, they should have, if it's one of these with alcohol in it, which has about a year from manufacture date, whether you have that one or whether you have the one without, which has a little bit longer shelf life to it. Anything we send you should have at least about a year to maybe 10 months at the shortest dating. So you shouldn't have anything close to its expiration date. But a lot of times I've heard horror stories of people, box gets stuck in the back of a cabinet somewhere and then it's pulled out 2 years later covered in dust and somebody's looking at expired tests. Again, you do not want to rely on the results of an expired test. That's important. All right, so let's go ahead and open it up. Now, I'm going to do my best, sort of, to keep everything within camera view. Like I said, unfortunately, we're not the best setup to get that done properly. So we'll see what we can do for you guys. But more important to show you just the overall workings of it and not necessarily methods to keeping it in camera view. So already I can tell I'm going to need to put this down out of here so I can open up the collection device. So basically, the test consists of two components. We have the actual test device, and then we have the saliva collection device. So basically, you're going to collect the saliva, press it into the test, and it's going to run, and it reads just like a normal urine test. So a couple things on this. So the trickiest part of oral fluids testing, most of the people that I've spoken to that had any kind of issue whatsoever with an oral fluids test, it was simply a matter of not collecting enough saliva. So I'm going to teach you some tips and tricks as to the best way to do that. I'll show you some ways to do it externally if it need be, and that sort of thing. So what we're looking at is, again, the sponge. If you're the mic, it's hard. You can't really squeeze this with your fingers. It's pretty hard. So in the instructions, it'll tell you to swirl it around your mouth and kind of compress it against your inner cheek or against your tongue, and kind of like you would a sponge. You pick up liquids with it, you squeeze it out. So what we're trying to do is get as much liquid into this sponge as possible so that when we do place it into the test device, enough of the liquid compresses out through the bottom and gets into the strips to properly wick up the strips. So my favorite cheat on this one is, instead of putting this in my mouth and swirling it around, I'm going to take some saliva and collect it in my mouth, and I'm going to kind of blow that saliva or press it with my tongue, or the pressure of my cheeks, into this. Now, I'm going to cheat today. Unfortunately, I am a little dry mouth, again, me on the camera like this. So while it is important that when you are doing testing that they have nothing in their mouth for 10 full minutes prior to collecting that specimen, like I said, I am going to cheat so I don't keep you here for half an hour while I try to collect saliva. So I'm going to go ahead and put just drink a little bit of water. And again, you don't want to do this when you're doing this in a real setting. So now that I've done that, I have a little bit of saliva in my mouth. I'm just going to go ahead and take that little bit of saliva and kind of press it into the sponge, like so. And you can already see this is starting to swell a little bit. It's getting a little bit softer. I mean, the base is still hard as a rock, but we'll keep adding a little bit of saliva as we go just so we can get it done. Now, the other thing you'll see on here is this little pink line that's just starting to appear. Sorry, the camera's reversed for me today. That pink line is called the saturation indicator. Now, that's supposed to be an indication of that you have enough saliva on the sponge to make the test function properly. However, I have found that you really don't want to rely on that. Listen, you all probably have some folks in your program that are difficult, maybe intentionally difficult, maybe they're having trouble getting saliva for whatever reason, but I could make that saliva indicator go off and then suck all this saliva back out of the sponge into my mouth, and I wouldn't have enough saliva for the test. So if you got somebody who, especially someone who might be difficult, please don't rely too much on that saliva indicator. You're going to start to understand, once you use these a little more, what the sponge should look like and what it should feel like, the weight to it, that sort of thing, how soft it should look. Obviously, I don't want you touching somebody else's sponge, but you can if you need to. So what I'm going to do is this. A lot of times people don't have enough saliva, so I'm going to give you an example of that now. So let's go ahead and, I can tell we don't have enough saliva, but let's go ahead and push this in anyway, just for kicks. So we're going to peel back the privacy label. Much like a drug testing urine cup, these have the privacy panels. And the reason they have the privacy panel is basically this. They want to give you the option of seeing the result before the donor sees the result. A lot of times people, a donor will see oh my God, I got a positive, and they're out of the gate. They're going to be on the offensive. They're going to put you on your back foot, and they're going to try and make the conversation. They're going to try and lead the conversation. So this gives you an opportunity to view the results decide the next course of action, decide the nature of the conversation, decide the direction the conversation should go in. And it just gives you a little bit more of control of the situation. So again, you don't have to use it, but a lot of people do find that useful. All right, so as we can see, nothing's happening on here. Obviously did not collect enough saliva. But the main reason I did this was just to show you that if this happens, you just go, doesn't come out that easily, but you pop it out, and you get back to work. So while I'm doing this, now another way you can do what I did, cheating, but without actually cheating, if somebody is having trouble, getting going with the saliva, there's a couple of different things you can do. There is a product called Biotene. It is available over the counter in most pharmacies and drugstores. And that is a medication that promotes salivation. Now, with the Biotene, you want to make sure it's used at least 15 minutes prior to running the test. But the effect of that salivary effect from the medication should stay for those 15 minutes. So you're good there. The other thing you can do is to smell something very pungent. Maybe, onions, maybe a horseradish, or, favorite foods. If somebody put a, nice bowl of chili in front of me, I'd probably start, salivating. So something like that is a good idea. Either your favorite food or something that's just very pungent is often enough to get that saliva going. As I continue to do this. While I'm doing this, because I'm still having trouble producing saliva for you guys, there's a couple other things you can do. If somebody is having trouble, giving you saliva on the sponge, you can have them expectorate right into the test device, or you can have them salivate in an external device. Here I have a little shot glass. That's water, don't worry, that's just water in there. But this little amount of water in the bottom of the shot glass is enough to make that test function. So if you have them expectorate into the shot glass or into any little vessel, you can then dump it right into the test device. Now, be careful, because the inside of this, I don't know if it's going to show on the camera real well, but there is a little circle there, and that's where you need to aim. If you end up way too far off to the right or to the left, the saliva is not going to get where it needs to go, and therefore you're not going to be able to have the test function correctly. Get myself a little bit more water. I don't want to keep you guys here all day. Now I definitely have enough saliva. You can see the sponge is kind of heavy. It's soft. Again, you don't want to have to touch somebody else's saliva, but that's how it works. So then you line it up, put it in, and press it. Now again, if I had been careful, I could have done this whole process on camera again, but now that the saliva is in there, we can go ahead and watch it develop. So as you can see, there are tests on both sides of this device. There's another tip for you is if you're not sure you have enough saliva, you can hold it a little bit above eye level, and you can actually see some saliva lurking in there. Another good thing to do about that, or to do with this information, is if you see that it's only wicking on one side, then you could lean it back or forward or side to side just to make sure that the saliva in the bottom is touching all of the strips. Now, as you can see, we're already seeing some wicking going on here, so that's good. That means my little cheating worked. Now, it's important, you can see on this side, by the way, that the alcohol strip is aligned differently than the other panels here. This is by design. It's not a mistake. It's not a defect or anything like that. The alcohol pad functions much differently than the other strips, so it has to be aligned a little bit differently. It's not quite as long. It just helps it work a little bit better by aligning it that way. So yeah, we're getting good wicking on that side and on that side, so this is going to work perfectly for us. As you can see on the bottom, they give you a little cheat sheet, and I'm sorry, the camera does not want to focus for me today. But basically, like on the drug testing cups, if we've got a line in the control section and a line in the test section, even if it's a faint line, that would be considered a negative result. If we have a line in the top, which is the control section, but no line at the bottom on the test section, that would be considered a positive result. And on this third example, regardless of whether we have a line in the control section, in the test section, if there's no line in the control section, that strip did not function correctly. And it's usually just a byproduct of the manufacturing process. Unfortunately, what you'll typically have to do in those scenarios is actually collect another specimen and run another test. Now, in urine testing, it's a big deal. If you've talked to me about urine testing ever, you've heard me say that you can't expect 2 urine specimens collected back to back to have the same chemical makeup. It just doesn't work that way. Your functionality of urination is purging your body of toxins. With saliva, it basically, your saliva is a similar toxicology to your blood. So if something's in your bloodstream, it's also in your saliva. If you've ever taken a medication intravenously at the hospital, the moment they hit that plunger, oftentimes you'll get a taste in your mouth. That is basically that toxin, in this case medication, it's coursing through your bloodstream and through your salivary system as well. So now you can see we've got the lines, they're coming up pretty good. Now again, this is all negative, of course, because it was essentially all water that I used for you guys today. It would be negative anyway, for whatever that's worth. Now here's the big important thing. The window of detection on a saliva test is much shorter than on a urine test. With urine testing, you get at least 2 to 3 days, depending on the drug, 2 to 3 weeks, depending on the drug, sometimes 6 weeks for marijuana, that sort of thing. With an oral fluids test, and it's not the test that is what's doing it, it's just the nature of human biology. Drugs are only going to be detectable in saliva for about 24 hours. You might get a little bit more depending on how the drug is ingested. If you take a drug by smoking it or snorting it, it gets in your bloodstream almost immediately, and therefore, you'll be able to detect it almost immediately. But then that 24-hour mark is going to be pretty solid. If you take a medication that is like a pill where you swallow it and it takes 20 minutes or 40 minutes to get into your bloodstream, then you'll have a little bit longer at the end of that window of detection where it might still be detectable. Some medications like the original oxycodone were made as time release. So if you take a medication that's time release, of course it's going to be in your bloodstream longer and therefore it will be detectable in your saliva longer. So that's important to note. This is one thing that's very different about urine testing. The other nice thing finally about oral fluids testing is we do finally have fentanyl available. That was a hurdle for a long time for a lot of people, and I don't blame you at all. Fentanyl is finally available as an oral fluids test, and I'm happy to say that this 1203 FSI does include the fentanyl and the alcohol, both of which obviously are very important to test for. So please keep that in mind if you're looking for fentanyl. You can finally get it done with this. And that's pretty much it. Again, we see the results up. I could have done it a little bit better trying to keep you guys on screen. Just not the best setup for it, but maybe I'll make a recording of that for you so you can see what I mean. All right, I'm going to check to see if we have any questions for you guys. It doesn't look like we have anything as of yet. Let me see if I can think of anything else that might be worth mentioning. So you'll notice on here I said that we have testing for alcohol. You notice I did not say ETG. So the reason for this is because of the nature of substances in your saliva. The value you would normally get from ETG is having that 80-hour look back or the 80-hour detection window. Then you lose that because now you're back on par with just the saliva testing. So in this case, it makes sense just to test for blood alcohol level, which you get about detection for about 1 drink per hour is about the average. So if somebody drinks a 6-pack, you theoretically will be able to detect that for 6 hours. All right, now the questions are coming in. Great. How soon should the test be read upon taking the sample? Excellent question. These should be read between 5 and 10 minutes. Typically with urine, you can read it by 5. You saw here we had pretty good lines show up at about 5 to 6 minutes. So start your mental timer from when you see the liquid migrating up the strip. So if you don't see any liquid migrating, obviously we've got to add more specimen to it. Once you see the liquid start migrating up the strip, that's when you can go ahead and start your mental timer, and then give it about 5 or 10 minutes from that point. Chris Montgomery, are these CLIA-waived? That's one little hindrance for some of you guys who are in the healthcare industry. Unfortunately, there are no drugs of abuse testing for oral fluids that are CLIA-waived as of yet. So as for now, they're what they call forensic use only, which basically means that you're not supposed to use these to make any treatment decisions. So they're perfect for criminal justice system, pre-employment, really any kind of testing where health insurance wouldn't kick in, for what it's worth. All right, it looks like that is all the questions we've got for today. Listen, I want to thank everybody for coming out today. Again, we just think that education is such a hugely important part of what we do, and more so what you guys are doing. And I'm happy to see, there are nearly 40 people here today. So leads me to believe that at least some of you agree with what we've got to say here. So I hope you found today was very useful, or at least a little bit entertaining or helpful. And we hope to see you all next time. So thanks everybody for coming out today.